Hello everyone, how is everyone doing today? Hope everyone is doing well. I'm just gonna get set up here on IG. Wait for you guys to come in a bit. Hi Marley Jane, how are you? Thank you for joining. How's everyone on Facebook doing? Hope everyone is well. It is Thursday, guys. The weekend is almost here. And the week is almost done. The work week is done. So I hope the work week has been great for you guys and things have been going well. And you're looking forward to the weekend as much as I am. All right, guys. This is 𝙬𝙞𝙩𝙝, Performance Plus Physical Therapy. This is Q&A with Dr. D, and I have been covering all things about the wrist. We'll be talking about the wrist and hand this week. And today's topic that we will be talking about is carpal tunnel syndrome. This is something, one of the more common diagnoses that you can get at the wrist and the hand that can happen with people. And I'm going to cover this diagnosis so you get a fair understanding of what it is, what it looks like. You probably or may have encountered it or know someone that has encountered it before. And we'll go through the reasons why you guys should really pay attention to this. Specifically, again, as COVID is going on, guys, there's a lot of people that are sitting in weird postures, sitting like this for a long period of time, sitting at desk setups that is not tailored to them because you're not in the office or your regular workspace. And for that reason, you really want to pay attention to certain positions that can predispose you to having these issues at your hand and wrist. Okay? Hope everyone is doing well. Hi to the guys on Facebook. Thank you for those guys on IG that are joining me. Let's get started, okay? So, carpal tunnel, guys. I have my little model here for you guys. Carpal tunnel syndrome is basically the description of compression of the median nerve within the carpal tunnel. Now, the question now comes about to be, what is a carpal tunnel? So in your hand, guys, remember that your body has a little bit of a network of nerves, blood vessels, including arteries and also veins, and that stream all the way from your neck, from your spinal cord, all the way through here, all the way down to your hand. Think of a branch, okay? Hey, Adana, how are you? All right, so that is what the hand looks like. So if we were to look at this on a model, it would look something like that. You guys see that? So you see that there's an extensive network of the blue, which is the veins. You see an extensive network of the red, which is the arteries, and then the yellow, which are the nerves, okay? When we're talking about carpal tunnel, guys, we're talking about the nerves, the yellow part. So the carpal tunnel is basically a little bit of a tunnel that sits right here, and that houses the median nerve, specifically one nerve that comes all the way out from your brachial plexus and comes all the way down your arm. It's one of those nerves, and then it also houses all of the flexor tendons. And the flexors are the muscles that kind of bring your hands together to form a fist and also bends your wrist down, those muscles specifically. And if you remember some of our talks, those muscles lie right about here and kind of come all the way here. They lie on the inside part of the elbow. They branch all the way here, go into that carpal tunnel, and then extend into the hand. Okay, so that is what it looks like. So what happens with carpal tunnel syndrome, guys? And I'm gonna bring up my model a bit here again so that you guys can see. Let's see, I'm not good at doing things backwards. But what I'm gonna do is identify that area where that carpal tunnel is compressed. And I'm also going to identify for you the nerve that it supplies, okay? The median nerve, I'm going to take off the blood vessels because that can become confusing. So you can see that green area that's highlighted there is the ligament under which the median nerve runs. When that gets tight, so think of it, guys, it's a very narrow tunnel. It's not very big. It's maybe, I would say in terms of proportions, it's maybe about that size, okay? So if for any reason the space between there that the nerve has to run gets enclosed or entraps, it presses on that nerve and it causes numbness and tingling all the way down the hands. And the area that you would usually find that numbness and tingling is here in the thumb and the index and the third finger. Okay, so that's where that manifests. So usually if you have numbness and tingling in your hand and it gets to those 3 digits, guys, that's where you know that you're getting some sort of compression on the median nerve specifically. Okay, when we are looking at the median nerve, and I'll enlarge this a bit for you guys to see, it gets a little bit difficult to see here. You can see that's highlighted in purple is the median nerve. Okay, and if I just kind of not hide everything else but fade everything else, you can see how it kind of runs all the way into the hand. Okay, so if for any reason that nerve gets compressed, guys, you're going to get that very characteristic numbness and tingling in the hand. All right, other things that you may experience if you're having this compression at the median nerve, you may experience that you have a lot of difficulty gripping things. So holding on to stuff becomes very difficult. Or you may notice that your hand is weak and your ability to grip things or to turn things now becomes compromised. You get numbness, you get tingling, you could also get some swelling in the hand, and it becomes really difficult for you to articulate and to use your hands. You may find that fine motor skills, like for example, buttoning a shirt now becomes really difficult. We usually button our shirts, or use buttons when we're manipulating buttons. We're usually using 1, 2, 3, these 3 digits. So you usually find that it now becomes very difficult for you to start doing those fine motor control movements that median nerve supplies. Okay. How do we get this, guys? How does carpal tunnel manifest itself? How do you suddenly wake up one day and be like, oh wow, I have carpal tunnel? Well, there are definitely telltale mechanics and certain things that will predispose you to getting this. So for example, if you're sitting at your desk, and as you can see, guys, that I'm sitting here, at least IG can see here, if you're sitting and you're in that position for a long time, you're putting that nerve on stretch for a long period of time. And that's one way that nerve can become compressed in that tunnel and start causing you pain. On Facebook, this is what it looks like if your hands are working in this position and you're typing for a long time. So for those guys that like to sit on the couch and lean back a bit and kind of type this way because it's comfortable and you just want to lounge, you're really putting your hand at a little bit of risk of really getting a lot of compression there. It also happens, guys, if you've had some sort of repetitive injuries. So for a lot of people that use their hands a lot, so for example, tennis players, they can sometimes start getting this because they're really using a lot of force, and if they're starting to use the extensors or the outside of the hand, you know, where they have to really hit the ball that way, and they can start getting some sort of entrapment there. Okay, so anytime that you really start getting compression, basically, guys, is very, very clear and very mechanical. If you have compression at that nerve, you're going to get numbness and tingling, and you're going to get resultant symptoms. Okay, this does progress over time, guys. It usually starts off with mild symptoms, and it usually progresses over time. It does get worse. It is way easier to treat in the beginning than it is later on. Because again, when we talk about nerve injuries, guys, we're really talking about a tissue that is not very responsive to healing as quickly as muscles or ligaments or even bone. Usually when nerves have been compressed for a long period of time, they start working, and it's very difficult for them to regenerate and to get back online in terms of the function that they usually do. So if you're noticing numbness and tingling, and this is a general statement, guys, if you're noticing numbness and tingling in your hand or even any other part of your body that's been going on for a while and it's consistent, you want to get on top of it. Once those nerves turn their lights off, they are done. Okay, so you want to get ahead of it so you do not lose your function of your nerves. You need those in order to supply the muscle function, to make sure the muscles are working, and also for the sensory stuff in order to feel things, and that becomes very important. We use our hands quite a bit. It is very difficult for you to grip things and to do fine motor skills if you cannot feel anything. Okay, so guys, what are other things that you would what are the things that we can do in order to start getting rid of these symptoms if you're experiencing them? One thing that you can start doing, physical therapy interventions are very common. We work on loosening the muscles and calming down the inflammatory processes happening at the carpal tunnel. And what that does is that it allows that swelling and that compression on that nerve to go down, and that decreases the symptoms. Another thing that can be done is steroid injections. It's not common, but sometimes it does happen. If your orthopedic doctor decides to go in that direction, they will give you a steroid injection. The goal there is to really decrease some of the inflammation that's happening there. It's very common for you guys to see people using braces. What that does, it holds your wrist in a neutral position. Usually a brace spans here. Depending on how involved you are, they may just isolate the wrist, or they may even isolate the thumb, or go a little bit further into the hand so that you cannot flex your hand and you cannot extend your hand. And what that does is it puts that nerve on slack, so it allows it to heal. Okay, so very commonly you would find people using braces to really try to relieve some of their symptoms while keeping them functional. There are a lot of different things that you can do for carpal tunnel syndrome. If you're having these symptoms, or you know someone that does, reach out to a physical therapist or reach out to me. It is definitely something that can be beneficial for you to get ahead of those symptoms before they do become chronic situation. Now, for the guys, if you are noticing that you have had these symptoms for a long time, and you are noticing sensory changes, lost numbness and tingling in the hand is now gone, or you're starting to notice that there are changes to the muscles, and what we call, you would see they are decreased in the size of the muscles of the hand. This is the thenar eminence. This is where your thumb is. You would see that there's a decrease in the size of those muscles. That's something that we call atrophy. If you start noticing these things and it's been happening for a while, hey, how are you? You will notice that it is about that time that you may have to get a surgical intervention, okay? And what surgery looks like, guys, is surgery is really going to address a more permanent solution of relieving the pressure that's being placed on that carpal tunnel. So again, going back to this little diagram here, you can see that purple line, that's the median nerve. What happens is the surgeons, either with an open arm surgery where they make an incision across the wrist, or they may do an arthroscopic surgery where they do small portals on either side and insert a camera so they can see what they're doing. They're going to go in and they're going to release that ligament under which that nerve lives. Okay, so basically by releasing that nerve and just that tendon and just cutting it, it now opens up the space that the carpal tunnel, or the nerve specifically, has to live, and that decreases a lot of the numbness, the tingling, and the consistent pressure that has on that nerve that causes your symptoms. Okay, it is a last-ditch effort. It is usually a successful surgery. Bear in mind, guys, and I've said this multiple times in a lot of my my lives and a lot of my videos, you do want to make sure that you do get a good diagnostician. Get a clinician that's able to look at you completely to make sure that this is the cause of your problem. I always say, when we come to surgery, once you cut, you cannot go back. So with that in mind, you want to make sure that if your surgeon recommends that you have carpal tunnel surgery, you want to make sure that the compression is coming from here and not somewhere else along the chain that's causing this problem. And this is why a lot of surgeons usually recommend that you go through physical therapy first, because we do look at all of those things to make sure that we're addressing everything that would contribute to your symptoms here. Okay? So that is carpal tunnel syndrome in a nutshell, guys. If you have any questions, please feel free to put it in the comments. I'm happy to answer your questions. Let's see. Hey, Trony, how are you? Thank you for tuning in. I see someone else is there. Thank you for tuning in. Hey, sir. Any questions for me? Adana was here. Mac Peas was here. Molly was here. Thank you for joining. So if you don't have any other questions, guys, I am going to head out. Please drop me any questions. If you do, if something comes up later, you're like, oh, I need to ask Danelle about this, definitely drop me some questions. Drop me a line if it's of a more private matter. Share this with someone who needs to know this. Okay, guys? We want to get the word out there that there are things that can be done if you are having symptoms in your hand. If you've had nerve symptoms before, you know how uncomfortable it can be. There are things that you can do to get ahead of it so it does not become a chronic situation and that you do not have to go to a surgical intervention. Okay, that's very important. So if we don't have anything else, I will see you guys tomorrow. Tomorrow, guys, we're going to be doing our exercises. We're going to go through some common exercises for the hand and wrist. And then next week, again, as I mentioned before, I do have a special guest. She was not able to make it this week, but she will be on next week. And she is a physical therapist that works with musicians. And we are going to be talking about the hand and wrist and a lot of things that affect musicians. So definitely stay tuned for that, okay? So hope everyone is well, and I will see you guys. Enjoy the rest of your day. See you guys tomorrow. Bye.